Okay. My name's Jessica. I'm a student from the Mississippi University for Women, and I'm in the RN to BSN program, and I'm going to be doing a presentation on the national opioid crisis. Okay. The objectives of this is, by the end of this presentation, the learner will be aware of the national opioid crisis. By the end of this presentation, the learner will understand the impact that the national opioid crisis has on the healthcare industry. By the end of this presentation, the learner will be able to identify the signs and symptoms of opioid abuse. And by the end of this presentation, the learner will understand the way that the community is trying to combat this problem, and also look at oneself and ask, what can I do to make a difference? So first of all, what is an opioid? An opioid is prescription pain relievers such as morphine, Dilaudid, Demerol, Lortab, and they're recreational drugs, heroin, and also synthetic opioids such as fentanyl. So how did this national opioid crisis begin? In 1990, pharmaceutical companies marketed opioids as a non-addictive painkiller. So in turn, physicians started to prescribe more and more opioids to treat the chronic pain that his patients were having. The misuse of opioids began to increase as the patients became addicted to these medications. And in 2015, 33,000 people died from an overdose to opioids. 2 million people had a substance abuse disorder, and 591,000 people were addicted to heroin. So how does this affect the healthcare industry? The biggest thing is that opioids are now misused. It's not only to just treat acute pain. They want, if they have a chronic condition, they want the painkillers to treat. We have an increase in opioid overdose, increase in neonatal abstinence syndrome, and increased incidence in hepatitis C and HIV, and that would be from the heroin addiction and using needles. So what do we know about the statistics? 21 to 29% of the patients with chronic pain are prescribed opioids. 8 to 12% develop an opioid misuse disorder. 4 to 6 transition from opioids to heroin. And 80% of people using heroin misuse opioids first. Opioids, whenever they have the painkiller prescription, it can be expensive. To buy bags of heroin, it's much cheaper for the patient. So they first become addicted to the painkillers. Once they can no longer maybe get the prescriptions or cannot afford it, then they go to heroin to get that same high. The impact on healthcare, you get an increased 911 calls for drug overdoses. You have an increased drug seeking and ER visits, delayed care for other patients in the ER that could be having STEMIs, strokes, and bullying from the addict to prescribe more opioids. So signs and symptoms, so that you can know that this may be happening to you, a family member, or a loved one. They have noticeable euphoria, marked sedation and drowsiness, confusion, constricted pupils, slow breathing, constipation, a doctor shock. If you know that they go to the ER in Corinth, the ER in Tupelo, they've been to the one in Iuka. They may be kind of looking at the ER doctor, seeing who might prescribe painkillers and who won't. Shifting or dramatically changing moods, sudden financial problems, isolation from a social life, and you start to notice extra pill bottles maybe showing up in the garbage can. So what are we doing about it? We have narcotic protocols in the ER. And this is actually the sheet that I went ahead and brought. We can actually print this off and put it in the discharge papers for a patient that may be seeking. Some of the guidelines, it says you'll be treated with narcotics no more than 3 visits in a 12-month period. We will not replace any narcotic prescriptions that is lost, stolen, expired, or destroyed. Demerol will not be prescribed or given in the emergency department. And then the following patients will not receive any narcotics at any time if patients who have been receiving narcotics from multiple providers. That would be for the patients that go to multiple ERs, kind of that doctor shopping that we talked about. Patients who have forged or altered prescriptions, and patients who give false information or attempt to obtain medications with false information. And also it tells them at the bottom that if 2 or 3 of these occur, we could contact law enforcement. Some of our ER physicians use Tylenol and Motrin as their first-line pain medications. Screen for high-risk conditions before prescribing opioids. Discuss other treatment options before just prescribing the pain medications. And train nurses on opioid use and addiction. So what can you do to help stop this opioid process? You can watch for signs and symptoms of opioid abuse with friends and family. You can be an advocate for the person struggling. And you can stay proactive with new, innovative prevention methods and rehabilitation services. These are the references that were used in this presentation. And keep calm and stop drug use.